Enrolling in Medicare needs to be done at the right time. There are specific enrollment periods for different purposes. Additionally, if you do not enroll at the right time, you may have to face substantial and permanent penalties. Let's get into the details. The initial enrollment period, also called IEP, is available for 7 months. It starts 3 months before the month you turn 65 and continues for 3 months after, for a total duration of 7 months. For most people, IEP is probably the best time to enroll in Medicare. For example, if you were turning 65 on July 4th of this year, your initial enrollment period would be from April 1st all the way to October 31st. If you have health coverage from a current employer with more than 20 employees or other equivalent coverage which pays first, you can defer your enrollment to a time when the situation no longer exists. You will have a special enrollment period, SEP, at that time, within which you may enroll without any penalties. Consult your employer for more details. Note that IEP does not apply to Medigap, which follows a different set of rules and guidelines. We discuss this later. Coming to General Enrollment Period, also known as GEP, if you did not enroll in Part A or Part B during your initial enrollment period, you can do so during the General Enrollment Period, or GEP, which runs January 1st to March 31st every year for coverage beginning July 1st of that year. Note that late enrollment penalties may apply during GEP. Every year, you get a chance to change your Medicare plan during the annual election period, which runs from October 15th to December 7th for coverage starting January 1st of next year. If you do not wish to change, you need not do anything. Your existing plans renew automatically. Your plans may have made changes to the coverage and/or costs for next year, or new plans may have entered the market. It is a good practice to review your plans every year during AEP and decide if you would like to change. Note that AEP does not apply to Medigap, which follows a different set of rules and guidelines. There are special enrollment periods as well, called SEPs. You may be eligible for special enrollment period based on certain events or circumstances. SEPs vary in length and typically include events such as loss of employer or retiree coverage, moving to another location, changing to a 5-star plan, existing plan withdrawing from your location or not renewing for next year, moving to another institution, or any changes in Medicaid-assisted coverage. There are other less common SEP events as well. Penalties are generally not assessed if you had equivalent coverage before the SEP event. For Medigap, there is Open Enrollment Period, also called OEP. OEP for Medigap is what IEP is for Medicare, and is typically limited to 6 months after turning 65 or enrolling into Part B. Guaranteed issue rights apply. There are some Medigap-related SEPs as well. Know that you can apply for a Medigap policy at other times too. However, policy issuance is not guaranteed, and even if issued, may have higher premiums due to your health condition. In other words, there are no guaranteed issue rights during other times. Now let's talk about late enrollment penalties. Late enrollment penalties for Medicare can be substantial and permanent, so make sure you understand the consequences of not enrolling at the appropriate time. For most people, Part A is premium-free. For others, missing out on enrolling in Part A when first eligible may result in a penalty as high as 10% of the premium for twice the number of years enrollment was delayed. For example, if you did not sign up when you were first eligible for Part A for 2 years, you will end up paying higher premium for 4 years. Again, this only applies if Part A is not premium-free for you. Penalties for a delay in Part B enrollment are much more severe. Your monthly premium will go up 10% for each 12-month period that you could have had Part B, and it is permanent. You will have to pay the penalty as long as you live. Part D, prescription drug coverage, late enrollment penalty is calculated by multiplying 1% of the national base beneficiary premium by the number of months you did not have Part D or creditable coverage. This can add up rather quickly. Do not go without PDP coverage or alternative creditable drug coverage for 63 days or more in a row after the initial enrollment.